Welcome back. Well, it may not be the leading headline anymore, but COVID-19 is impacting people for the long haul. KTIV's Taylor Decker sat down with two men from Siouxland who are still dealing with symptoms years after their positive test. It's tonight's Healthbeat 4.
I thought the big thing was fighting like hell to get out of the hospital and beat COVID. I didn't know that was just the beginning of what would be a long ongoing fight.
Ed Pickens of Dakota City, Nebraska spends most of his time at his home after having to leave his job due to the significant life change after getting COVID-19 in March of 2021. He was in and out of the hospitals as his symptoms fluctuated.
I thought, this is my time. I just kept getting worse and worse.
Gary Lewis of Sioux City tested positive for COVID-19 August 12, 2022, and says his life hasn't been the same ever since.
A little bit of cognitive difficulties, the tremors, the not being able to come up with words as quickly as I used to.
Both say they are still symptomatic, impacting their day-to-day routines.
The coughing, the heart palpitations, the foggy brain, shortness of breath.
Walking is something that Lewis is having an issue with too.
I've had specialists that I can see the pain in their eyes. A couple of them to tell me we don't know what to do.
Both are trying different medicines, even different doctors trying to find a solution.
The Mayo Clinic tells me, this is real. What you got is real. You've got a brain injury from COVID. I just got done with 12 weeks of treatment at Madonna, a long COVID clinic in Omaha.
Both medical providers for Lewis and Pickens declined interviews with us to discuss their treatment. Pickens was told he was not approved for medical disabilities insurance policy. He says his original primary doctor would not sign off on his medical documents.
Nobody wanted to touch this COVID thing.
U.S. Health and Human Services says long COVID can be a disability if it substantially limits major life activities.
We're coming up on 2 years now. I hope I get better, and for my part, I'm doing what I can.
Pickens tried to go back to work as well, but the long COVID symptoms kept him from his best performance. He was eventually told by his employer he had to retire due to medical reasons.
I have to really watch over doing it.
Pickens says what keeps him going is his granddaughters trying to stay healthy.
One doctor said, Ed, why don't you, I want to watch them to go to college or high school, and he said, why don't you stay alive long enough to dance with them at their weddings? And I said, that's my goal.
For Healthbeat 4, Taylor Decker, KTIV News 4.
Lewis and Pickens actually connected through a Facebook group. It's called Long COVID Sucks. Lewis started this group, he says, to give patients a place to connect. You can learn more about long COVID in this story right now on KTIV.com.